Good evening. Today is September 14th. This is Alicia Saratani, and you're watching Off the Cuff. Joining us tonight is EIR historian Anton Chaitkin. You may remember Mr. Chaitkin, and if you don't, Ezekiel Emanuel certainly does, from an intervention Tony made back in June at a meeting of the Federal Coordinating Council on Comparative Effectiveness Research. Since this intervention, Tony has worked closely with Lyndon LaRouche, exposing the origin of the Obama administration's healthcare reform. In his recent article called "The British Monarchy Caught in a Death Scheme," Tony uncovers something incredibly damning. Not only is what the president proposing a carbon copy of the Nazi T4 program of rationing care to those lives not worthy of life, but that Nazi policy back in 1939 and Obama's policy today comes straight from Britain. Tony, welcome to the show.
Thanks, Alicia.
So, you've written this new article, and it's posted on our website, and people can get it and circulate it. But what makes the story that you document here so explosive?
The British royal family itself is supervising the imposition of all-out euthanasia in England now. This is not just crazy financiers panicking from the crash. They demanded this, but the royal family has really been working on this policy for a long time, and this is implemented directly by Prince Charles and people who work with him, including some people here in the USA who work with Prince Charles directly, to bring that murder policy for the elderly and the frail people in England over here.
Right. In the beginning of the article, you mentioned that under the Liverpool care pathway adopted for general use by the National Health Service, or the NHS, those showing symptoms that might foreshadow death are targeted to be killed by heavy narcotics and the withdrawal of fluids and nutrition. The new policy reportedly accounted for about 1/6 of all deaths in Britain last year, according to a study done by Dr. Clive Seal. So what is the NHS doing that would be responsible for 1/6 of all the deaths just last year in Britain?
After the crash, they set up a national task force in England under the National Health Service to identify how they could proceed to save massive amounts of money to pour into bailing out the London and Wall Street bankers. And this strategy was already in a pilot project at the Liverpool killing test facility of the Marie Curie Hospice. Prince Charles is the president of that hospice. He is also the president of a fund called the King's Fund, which is a think tank of the royal family that has organized this killing procedure devised in Liverpool as a national program once they got it going back in 2004. And the first step is to select the people who are seen to be weak or showing signs that they may soon statistically be considered near death. Those people are immediately put on heavy narcotics, and they pull the plug on nutrition and hydration. They also have in the strategy, which is reviewed in a report in July by the National Health Service, what you do with the bodies, how you deal with the families of the patients who are outraged and confused that their loved one has been killed, and a straightforward proposal for falsifying death certificates so that it doesn't appear that the people were killed but died of some underlying health cause. This is precisely what happened in the first phase of the T4 action program of the Nazi euthanasia in 1939, that they had to falsify the death certificates because people in Germany still wouldn't put up with this, even though you had this war under the Nazis.
Right. Now, there's a particular section of your article that gets a little bit deeper into the historical roots of the health reform genocide in Britain, because from what I understand, it goes beyond the 1930s and 40s. And so for our viewers who are not as familiar with the British Empire or its methods, particularly on the social programs like healthcare, can you develop some of those historical roots?
Yeah, as Lynn and LaRouche pointed out, the monarchy took direct control over the empire, or took supervisory role over the empire in 1858, when the people in India revolted against the East India Company rule there. So under Queen Victoria and her disgusting son, Edward, who became Edward VII, they devised all kinds of new Dark Age fanatic ideologies and methods, including things like eugenics, euthanasia, investigations of paranormal activities, psychical research, and various occult theocracies. And these became the regime in England as you got into the 20th century. This is the basis for fascism. King Edward VII, when he was crowned in 1901, corresponding also with the bringing in of Teddy Roosevelt over here, he put into a corporation the King Edward's Hospital Fund for London. This fund was to reform healthcare in England in accord with the Fabian Society and these occult fascist empire points of view. This really goes back to their empire in India. That is where they hired Malthus for the empire to devise explanations as to why millions of people in India were dying. And the explanation was that there were too many of them, and that causes the natural law of overpopulation, and you have to kill people en masse, or that nature is doing that anyway, and you should withhold food and so forth from the population. So this is the beginning of the eugenics movement, and that was the driving concept behind this what you call think tank that was set up in England back in 1907, incorporated. In 2008, this same fund for reform of hospitals and healthcare that had been going on in England all the time was reincorporated by Queen Elizabeth II. Prince Charles had been in charge of it since 1986. And this gang went into the implementation of what was now involuntary euthanasia. Remember that back in the 1930s, when the Nazis were trying to implement what they called mercy killings, the British set up the Voluntary Euthanasia Society to promote mercy killings in the world behind and in support of the Nazi efforts in Germany. But they always said at that time that this was voluntary, that this was like assisted suicide. What they're doing now, under this mad drive for cost-cutting, is not suicide. It's not voluntary. It's not living wills. This is beyond that. Living wills they invented before. The Voluntary Euthanasia Society of England instituted living wills that you may sign. Now they're doing mass involuntary killing.